Hello once again. This is your sharing doctor, Dr. Daisy Day. What we'll be discussing today is about hepatitis B. What is hepatitis B or Hepa B? Hepa B is a liver disease that is caused by the Hepa B virus. And this virus is contagious. Hepa B or hepatitis is a word that comes from the Greek word hepar and itis. Hepar means liver and itis means inflammation. So it's actually inflammation of the liver. Most of the medicines given to supposedly treat hepatitis B is only to suppress the virus. The scary part is that HBV is 50 to 100 times more infectious than HIV, and usually co-infection with hepatitis B and HIV happen. Also, Hepa B and D are common, studies say. The good news is full recovery from the disease is high in most adults afflicted with hepatitis B, even if their signs and symptoms are severe. But infants and children are more likely to develop a chronic or long-lasting hepatitis B infection. Now, hepatitis B increases your risk of developing liver failure, liver cirrhosis, a condition which is permanently scarring the liver, and also liver cancer. Hepatitis B or Hepa B is potentially life-threatening viral infection, as I've said, affects the liver. But the good news is that recovery is possible, especially for adults. But infants and children are more likely to develop a long-lasting or a chronic hepatitis B infection. What is the difference between acute and chronic hepatitis B? Hepatitis B infection may either be short-lived, acute, or long-lasting, chronic. Acute hepatitis B infection lasts less than 6 months, while chronic lasts for more than 6 months. By the way, do you know that a healthy immune system can clear acute hepatitis B from your body and make recovery complete within a few months? Most people who get hepatitis B as adults have an acute infection, but it can lead to chronic infection. Chronic hepatitis B infection, it lingers because your immune system cannot fight off the infection. Chronic hepatitis B may last for a lifetime, possibly leading to serious illnesses such as cirrhosis and liver cancer. The younger a person gets hepatitis B, like newborns and children younger than 5-year-old, the higher the risk of infection becoming chronic. Chronic infection may go undetected for decades until a person becomes seriously ill from liver disease. Now, what are the signs and the symptoms of hepatitis B? This range from mild to severe, usually appearing from 1 to 4 months after infection. Some people, example, young children, may not have any symptom. One of these is yellowing skin and yellowing of the white of the eyes. It's also called jaundice. Another is puking or vomiting or nausea, loss of appetite, fever, dark urine, abdominal pain, joint pain, weakness, and fatigue. What is the cause of hepatitis B? Well, as I've said in the first part of our discussion, hepatitis B infection is caused by the hepatitis B virus, or what is known as HBV. The virus is passed from person to person through blood, semen, or other body fluids, and through food. It does not spread by sneezing or coughing. Common ways that HIV can spread are the sharing of needles, the use of needles and syringes contaminated with infected blood is a sure way to spread Hepa B. Also, sharing IV drug paraphernalia puts you at high risk of hepatitis B. Another is through accidental needle prick, which is a concern of healthcare workers and anyone else who comes in contact with human blood. The other is through sexual contact with an infected person. This can cause Hepa B virus to go through the body through vaginal, seminal, and saliva secretions. Perinatal transmission among pregnant women is another way to infect a baby. They can pass the virus to their babies during childbirth. What are the risk factors? Well, the risk factors are through the blood, through the semen, and body fluids, as I have already mentioned. Another is working in a job that exposes you to human blood. Another is travel to regions with high infection rates of HBV. According to research, these are Asia, the Pacific Islands, Africa, and Eastern Europe. What are the complications? Well, the complications are liver cirrhosis, liver cancer, and even death. Now let's go to the natural remedy for hepatitis B. Number one is eat a healthy and well-balanced diet. A balanced, nutritious, and anti-inflammatory dishes are the best. This will equip the body's immune system to heal and regenerate liver cells and fight the Hepa B virus. Number two is taking more chlorophyll foods, which are beneficial for reducing oxidative stress and liver damage. Number three is rehydration. The tendency of hepatitis B patients to puke or to vomit makes them dehydrated. That's the reason why there is a need for rehydration. Now, rehydration entails taking lots of water. As much as possible, 9 to 12 8-ounce glasses of water every day. You can also take some cocoa juice or buko juice, the fresh buko juice. But the more important thing is taking 9 to 12 8-ounce glasses of water every day. And be sure you are hydrated well. Because no matter what you do, if you are dehydrated, no medication will work. The number four remedy is to cleanse your liver by taking cleansing foods. Some of the most beneficial, detoxifying, and liver cleansing and cancer fighting foods include leafy green vegetables like saluyot, spinach, arugula, romaine lettuce, kangkong, malunggay, kamuti shoots, pechay or bok choy, fresh organic pineapple, and cruciferous vegetables. This would include stick tree leaves or malunggay, cabbage, cauliflower. You can also take collard greens. Eating fresh seasoned whole fruits and drinking vegetable juices are very helpful for liver health. Also, root vegetables like sweet potatoes, carrots, butternut squash, and beets are very helpful to the liver. Fresh whole fruit, eating blueberries, citrus fruits, strawberries, lemon, grape juice, etc., are very beneficial for the liver health. Also, fresh herbs, basil, garlic, onions, ginger, turmeric, parsley, oregano. Eating organic meat, wild caught fish, native chicken or duck are also very nutritious. Grass fed cattle or chicken liver are also very good. And taking probiotic from fermented foods are also very important. Take your natural yogurt, cottage cheese, kefir, kimchi, sauerkraut. These are very good for the liver. Also, nuts and seeds like flax seeds, walnuts, and chia seeds. And the last is you only take unrefined oils, such as coconut oil or extra virgin olive oil. Now, puking or vomiting is common in acute hepatitis B condition. And so I would like to give you a tip. Add 1 to 2 drops of peppermint oil to a glass of water. This will help get rid of vomiting naturally. Also, you have to avoid inflammatory foods and drinks to help prevent the spread of the virus and ease the symptoms of an acute infection. This would include sugar, refined oils, refined carbohydrates, highly processed foods, unhealthy dairy products, farm-raised meats, and fried foods, especially those fried in vegetable oils. You also have to consume bone broth, which is very full of essential nutrients because this will boost your immune system and help fight the virus. Instead of turning to sport drinks, which are laden with sugar, artificial flavors, you can take coconut oil to ensure electrolyte balance. Avoid drinking alcohol or using OTC drugs, especially those which are for pain relievers, because they can worsen liver damage in people with hepatitis B. The last is to kill the virus with electrofrequency resonance. I use it myself, with my family, and with clients with wonders insofar as putting off the HB or the hepatitis B virus infection is concerned. I hope that this will help you a lot. Those who are affected with Hepa B virus, I just hope that you get something good from this. And for those who do not have it yet, I think you can evade or you can avoid having the virus if you paid attention to what have been discussed. Thank you, and may God bless you.